Cancer Conversations, a Harold Leever Regional Cancer Center podcast discussing all things cancer and giving you information to improve yours or a loved one's cancer journey. Hello and welcome to Leever Cancer Conversations from the Harold Leever Regional Cancer Center. Today we're happy to welcome back Dr. David Hill, MD, Director of Clinical Research at Waterbury Pulmonary Associates, to talk about smoking cessation. Dr. Hill is chairperson of the National Board of Directors of the American Lung Association and assistant clinical professor of medicine at both Yale University School of Medicine and the Frank H. Netter, MD, School of Medicine at Quinnipiac University. Today we'll be discussing the dangers of smoking and vaping and how to reduce your risk of cancer by not smoking. Hello, Dr. Hill. You're very welcome.
Hi, how are you?
Doing well. Let's start with the dangers of smoking. Why is smoking bad for our health?
Well, we've known that smoking is bad for our health for more than 50 years now. The first Surgeon General's report on smoking and lung cancer came out in 1964. And smoking is obviously bad for our health because of lung cancer risks, but it's bad for our health for a variety of reasons. We see increases in chronic lung disease, both asthma and COPD in smokers, and we see worsening cardiovascular disease, so increased risk of heart attacks and strokes. And smoking is also associated with other cancers aside from lung cancer. So head and neck cancers, bladder cancers, they're all seen at higher rates in people who don't smoke.
So tell me, how can we reduce the risk of cancer by not smoking?
So the biggest thing is if you don't smoke, don't start. And if you do smoke, talk with your healthcare providers about the best options for stopping smoking. The best way you can protect your health is to not smoke at all. Cutting back tends to not be the right approach. Stopping completely is the best way to approach this. And in 2025, we have tools that really can help people get away from smoking.
And what kind of tools are they?
So both counseling, either in person or virtually through online forums, can help people stop smoking. And then there are medications that are available both by prescription and over the counter that can help people break the addiction of smoking. And I do want to point out that this is an addiction. Nicotine is as addictive as heroin. It's just easier to obtain.
Some people think that vaping is not as harmful as smoking. Is that fair?
The true answer is we don't know enough to be sure. What we do want is when people are addicted to nicotine for them to break free of the addiction, and rather than switching from one form of nicotine addiction to another, cessation is the primary goal. What we see with vaping or e-cigarettes is a large number of people continue to smoke traditional cigarettes despite vaping. And the bigger concern is we're seeing a new generation get addicted to nicotine through the promotion of vaping products to youth. So we see high rates of use in middle school and high school age kids, and we don't want the next generation to be using these products.
Absolutely. If someone has been smoking for years, what are the benefits of stopping now?
So it's never too late to stop. In terms of cardiovascular disease like heart attacks and strokes, your risk goes down almost immediately when you stop smoking. For cancer risks, people who've smoked heavily for years are still going to be at higher risk for cancer, but the sooner they stop, the lower their risk becomes. With loss of lung function that we see with COPD, the rates of decline in lung function go back to that of a non-smoker as soon as someone stops smoking. So even though you may have done damage by smoking, the sooner you stop, the less damage you'll do.
That's an interesting fact. And it's a known fact that stopping smoking is difficult. What is the best way to do it?
The best way varies person to person. So a lot of my patients will tell me they want to try stopping on their own cold turkey. That's great when it works. Unfortunately, that works based on the data less than 10% of the time. In terms of other therapies, going through a smoking cessation program helps. And then with medications, the best medication we have available is varenicline, which was sold as Chantix. Quit rates with that approach about 40%. With other medicines or nicotine replacement therapy, such as the patch, the quit rates are in the 20% to 30% range, which is still significant, particularly if people make more than one attempt. So I always tell people if they tried to stop smoking and didn't succeed, it doesn't mean they can't try again. And each person has to find the method that's going to work best for them. People who are heavy smokers, sometimes I will use medication with what is called a gradual quit approach. So if you're smoking a couple of packs of cigarettes a day, we will have people work on cutting down to a pack a day in the first month, half a pack a day in the second month, and complete cessation by month 3. It's not cutting back forever. It's cutting back gradually with set goals. I have a lot of people who tell me they're cutting back, but they've been cutting back for 5 years. And it tends to be they cut back on their smoking until something makes them smoke more. So the goal is really to get to the point where you stop completely. If you stop using nicotine-containing products for 72 hours, you have quit. You're past the physiologic stage of addiction. There are habit forms of this that last longer. I always tell patients they need to come up with a quitting plan. So when you choose the date that you're stopping smoking, you want to have no tobacco products in your house. You want to get rid of things that you associate with smoking. You want to stay away from people who smoke. So if there are friends or social activities you do where you typically smoke, it's time to take a break from those.
Sounds a little like dieting. Don't have anything in your house that is going to take you off track.
Right. You want to set yourself up to succeed.
And do you have any statistics on how many times a person might actually try?
I don't have statistics. I can speak from having been a pulmonologist for close to 30 years. Sometimes it takes 3 or 4 attempts for a patient to successfully quit. They have to be in the right place in their life. Sometimes a spouse or significant other needs to quit with them. So if you're in a smoking household, sometimes it's best if people make the attempt because it's hard to stop smoking when somebody's smoking with you.
Right. Yes. As in any of the other addictions, that's probably true.
Indeed.
And do you have any other thoughts to share with us?
We talked last time in the podcast about lung cancer screening. So if you do smoke, you need to speak with your provider about whether you might be a candidate for lung cancer screening. It's still the best idea to just stop smoking, but there is screening available, and if we catch lung cancer early, we can cure it.
Excellent. Well, I appreciate you being with us again today and sharing your expertise, and we look forward to talking with you again in the future.
Happy to speak with you again today, Paula. Thank you for your time.
Thank you so much.
Be sure to check out our website, leevercancercenter.org, for more great content and new podcasts. Content produced by Leever Cancer Conversations is for the community and is for education purposes only. We do not diagnose, treat, or offer patient advice. Thanks so much for listening.